2A, 2X, there's a slightly different version. Some turn over ATP faster than others. And the version that the slow twitch fibers have turns ATP over more slowly. So that whole process of ATP binding, followed by hydrolysis, followed by re-energization of the head, is just slower for the slow twitch fiber. So it's doing cross-bridge cycling like this. And then the fast twitch fiber is going like this. And it can go faster just because that enzyme is doing its job faster. From binding to hydrolysis to re-energizing the head, it's all happening quicker. So you can build tension faster, and you can relax faster. Slow are also called oxidative because they rely on aerobic pathways. And if they rely on aerobic pathways, then they have a lot of oxygen and a lot of mitochondria. So myoglobin content is high. Color is red. And the color is red because of the high myoglobin content and because of the high hemoglobin content. Hemoglobin's in blood, so if you have a high capillary density, a lot of blood flow, then you have a lot of hemoglobin, red appearance. And with a lot of blood flow, you deliver a lot of oxygen. And where does all that oxygen go? Into the mitochondria. So if you're going to have increased blood flow, then you better have increased numbers of mitochondria to take up all that extra oxygen that you're delivering. So capillaries, mitochondria, color, myoglobin content, primary pathway for ATP synthesis all go together. Don't have to memorize it if it makes sense. It should be that way. In comparison, fast twitch are fast because they have a faster version of myosin ATPase. And with a faster version, the speed of contraction is greater. You reach peak tension faster. So faster twitch, faster speed of contraction. They're called fast glycolytic because they rely mostly on glycolysis. More so anaerobic than aerobic. Reflected by the lack of myoglobin, capillary density, mitochondria. When you compare those characteristics of fast twitch compared to slow, few capillaries versus many, few mitochondria versus many. A pale white color instead of red, both because of the low capillary density and the low myoglobin content. And if you're going to make ATP anaerobically, then you're going to use glucose. Cells, regardless of the fiber type, only store enough creatine phosphate to last about 10 to 15 seconds. So beyond that, you're going to have to rely on either glucose or fatty acids. Slow twitch relied more on fatty acids. They have lower glycogen stores. But fast twitch use exclusively glucose. Little, if any, fatty acid metabolism. So they have higher glycogen stores. And then going back to motor units, recruitment order. Slow twitch, associated with small motor units, recruited first. Fast twitch, associated with large motor units, recruited last. The in-betweeners would be in the middle. If you rely on aerobic pathways and you produce very little lactic acid, then you should be fatigue resistant. But if you rely on anaerobic glycolysis, in which case you do produce a lot of lactic acid, then you should be fatigable. So again, make sense of these characteristics. They're logical. Don't need to memorize them. And then in the end, activities best suited for. So if you don't generate a lot of force, but you generate force over a long period of time, then your endurance. Prolonged submaximal activities. A light jog for 2 hours instead of a full-out sprint for 30 seconds. If you're fast twitch, that's exactly what you want to do. All out, very short term, so that you're done before you even fatigue. So sprinting, power movements, lifting weights. Make sense? Next section is fatigue, which you covered in PhysioX. We've got some cool images of muscle fibers. Here, not only do you see the difference in color, here's the red, slow oxidative, the pale fast glycolytic. Fast glycolytic. There's an in-betweener, fast oxidative. Notice the size difference too. Right? It's not just the color, the cross-sectional area. Fast glycolytic is much bigger. More cross-sectional area, more myofibrils. More myofibrils, more force. Stronger contraction, more tension. Fatigue is a decline in muscle force in response to repetitive stimulation. During experimental, like PhysioX, isometric twitch contractions, muscle fatigues faster when the frequency of stimulation is higher. So you should have seen something like, at a relatively low frequency, that force is maintained for a really long period of time before it declines. But at a much higher frequency, the force should have gone down much sooner. Does that sound familiar? So they should have had you play with the frequency of stimulation to get a sense of how much longer the muscle can contract before it fatigues if it's low stimulation, or how short the activity will be. How quickly it will fatigue if it's high frequency stimulation. Did you guys see that? You remember that at all? The main point was to show you if you keep stimulating, force goes down. But beyond that, they should have had you play with the frequency a little bit. If they didn't, that's something you can always go back and play with. Muscle fatigue depends on the type of exercise. So if we're dealing with high intensity exercise, then we're recruiting large motor units. And so we're using fast twitch fibers, the big boys. And the downside to recruiting large motor units, and thus fast twitch fibers, while you get a lot of force and power, short duration. So the fatigue ends up coming from changes in pH. Lactic acid accumulates, it's an acid, it dissociates hydrogen ions, pH goes down, that negatively affects enzymes, proteins of all kinds in the cell. Full recovery is relatively fast. We're talking about minutes, maybe hours, but typically minutes. So when you do interval training, you're focusing on anaerobic pathways, running as hard as you can for a minute or two, and then take a break for a minute or two, and then run as hard as you can for a minute or two, take a break for a minute or two. And that minute or two break is long enough to allow you to do it again. But if you're going all out and all out's kind of vague, let's say instead of 100%, you're going 80% of maximal effort to run a mile. Basically, run a mile as fast as you can. Obviously, that takes more than 30 seconds to a minute. So you can't literally sprint a mile as fast as you can, right? But you can have a pretty hefty pace. And you probably did this a lot in grade school. And you were timed. You guys remember running a mile? Maybe yes. It's been a while now. High school, maybe?
Yes.
Do you remember how you felt afterwards?
Yeah.
Probably took a while before you would even think about running another mile. 2 minutes wouldn't be enough. Now you're probably looking at 20 minutes, 30 minutes to be able to do it again and put the same amount of effort into it. Right? So the more intense and the longer the duration, the longer the rest period is going to have to be. Low intensity exercise, like walking. Now you're just recruiting small motor units. Maybe medium, but certainly not large. Fatigue from lactic acid should not be an issue. And you're doing this for an extended period of time, typically hours, like a marathon training. So that these type 1 fibers are fatigue resistant. But what that refers to specifically is avoiding a decrease in pH because they don't produce very much lactic acid. Slow twitch fibers are called fatigue resistant because they don't experience the drop in pH from lactic acid buildup. That doesn't mean they can't fatigue, period. Once you run out of fuels, you will fatigue. And that's usually the limiting factor when it's prolonged activity. Jogging or riding a bike for 2, 3, 4 hours. What usually limits you in the end, and the reason you're exhausted and you just feel like you can't go any longer, has nothing to do with lactic acid. It has to do with depleted fuels, dehydration, ionic imbalances, in general or locally in the muscle tissue, and that ends up causing the fatigue, not lactic acid. Full recovery is relatively slow because, again, it took hours to fatigue you in the first place. And it's going to take hours and maybe days before you're ready to do that same activity again. Like a marathon. Hard to do that 2 days in a row. And these ionic imbalances will be explained a little more in the next section. Physiological fatigue. There's physiological, there's psychological. And in a nutshell, psychological is your muscle may be capable of contracting, but you just don't have the will. You're not going to try to contract the muscle. You're done. You're not going to stimulate those muscles anymore. Physiological fatigue is you've got the will and you're trying, but the muscle just won't do it. It's done. You're sending neural signals, but either at the neuromuscular junction or within the myofiber, it's not capable of continuing. Possible reasons. Rate of ATP breakdown exceeds the rate of synthesis. So this is physiological fatigue associated with running out of fuels. This goes back to low intensity, long duration. Slow twitch fibers. We call them fatigue resistant, and in terms of lactic acid accumulation, they certainly are, but you can run out of fuels. Number 2, a decrease in pH from lactic acid accumulation. So this particular physiologic fatigue is associated with fast twitch fibers, high intensity, short duration. The reason we call fast twitch fibers fatigable. Right, so the first one is associated with prolonged exercise. Second one associated with high intensity, short duration exercise. Third one, ionic imbalances, also associated with low intensity, long duration. These ionic imbalances include calcium and potassium. We often see a net loss of potassium to the ECF, especially the T tubules, because sodium-potassium pumps can't keep up. So here's a generic cell membrane, outside, inside. To depolarize the cell membrane, you open channels, you bring sodium in, it's positive, so it makes the inside positive relative to the outside. And we call that depolarization. And about a half a millisecond after the sodium channels open, they close. And at about the same time they close, what opens? Voltage-gated potassium channels. And so positive charges begin to leave. As potassium leaves, what happens to the membrane? It becomes negative again. Because positive charges are being removed. And they're going to the outside, making the outside relatively positive. And this happens over and over. Every time an action potential comes down the sarcolemma and down the T-tubules, the membrane experiences those changes. It goes from minus 85 to plus 15, back to minus 85. Sodium comes in to get it up to plus 15. Potassium goes out to get it back down to minus 85. And we've seen potassium gradually over time start to accumulate in the ECF. And the levels correspondingly decrease in the ICF. And the only explanation for that is the pumps, for some reason, aren't able to keep up. So if you start losing your concentration gradient for potassium, it's going to become more and more difficult to repolarize the membrane and maintain a normal resting membrane potential. And when you can no longer generate an action potential, that's physiologic fatigue. The muscle simply can't contract. And then with calcium, there may be damage to the sarcoplasmic reticulum from prolonged contractions, reducing the ability to normally restore and re-release calcium over and over and over again. And then number 4, neuromuscular junction fatigue. Right? Those first 3 had to do with the muscle itself, the muscle fiber itself. And this last one has to do with communication between the muscle fiber and the motor neuron. This may be a problem at very high exercise intensities. When the frequency of stimulation, the rate of action potentials coming down that motor neuron is extremely high. One after the next, after the next, after the next. In which case you keep stimulating the axon terminal to dump out acetylcholine over and over and over and over again. Now in general, once you release ACH and acetylcholinesterase breaks it down, it actually recycles the component parts. Acetic acid is plentiful in all cells. They can make it really easily, so that's not going to be a limiting factor. The choline, however, is returned back to the axon terminal. So ACH is broken down into acetic acid and choline. Choline goes back into the axon terminal and is used to remake more acetylcholine. Well, if the rate of release is so high, without much time in between action potentials to break down, recycle, and resynthesize acetylcholine, you could potentially run out. It could be that the axon terminal can't keep up and can't resynthesize acetylcholine fast enough. So that would be neuromuscular junction fatigue, depletion of ACH stores and release. Psychological fatigue is a lot easier. It's very simple. You just don't want to contract those muscles anymore. And the general feeling you have causing you to not want to keep going, pain and exhaustion. From one of the physiology books I use and use to supplement our lecture slides, I came up with this one. They've got central fatigue, which is a problem of the brain, versus peripheral fatigue, which is a problem of the motor unit, the neuromuscular junction and or the muscle fiber itself. So which one of these is associated with psychological fatigue? Central. And physiological fatigue? Peripheral. So just different names for the same phenomena. Adaptations to training. Last topic. Adaptations are specific to the fiber type's stress. So depending on what your goals are, your training method is going to vary. If what you want to do is increase muscle mass and strength, then you need resistance training. You need heavy loads or resistance applied to the muscles to make them work harder. The harder you make them work, the stronger they get. The body has a way of adapting to stresses so that it can better tolerate those stresses in the future. So when you start this new exercise routine of lifting weights, you're going to lift weights that are a little bit heavy for you, something you're not comfortable with. It shouldn't be easy because you have to stress the muscle. And after using that particular weight, maybe it's 20-pound dumbbells for bicep curls, after doing that for a week or two, it starts to get easy. You get comfortable with it. You can do more and more reps. Well, if you want to get even bigger and stronger than that, what do you have to do? Increase the weight again. Because your muscles keep adapting, you have to keep stressing them with more and more resistance. Which fiber types are you stressing with resistance training? Fiber type. Fast twitch or slow twitch? Fast twitch. Not for speed, but for strength. They're the ones that produce the most force. And how do fast twitch fibers respond to stress? They increase in size. The diameter gets bigger. And if you have a bigger diameter, then that means you can pack more myofibrils in that muscle fiber. And that's the theory behind hypertrophy. Not that you increase the number of muscle fibers in the muscle belly. You take the muscle fibers you already have and you make them bigger. You make them bigger by packing in more myofibrils. So the protein synthesis that's involved in building muscle tissue is really at the myofibril level. Building more structural proteins, contractile proteins, regulatory proteins, building more and more myofibrils. And that increases the size of the fiber. And it's not just a size change, there's also an enzymatic change. The enzymes that this muscle relies on to generate ATP are going to increase. Basically, what's going to happen is the fast twitch fiber is going to get even better at what it's already good at. What is it already good at? Producing lots of force because they're big in general. Now they're going to get even bigger. And producing ATP anaerobically. They have lots of glycolytic enzymes in the cytosol. They store lots of glycogen in the muscle cell. So they will store even more. And they will have even more enzymes to carry out anaerobic glycolysis. Low intensity, prolonged exercise, endurance training, stresses slow twitch fibers, type 1 fibers. When you stress a type 1 fiber, you're not really asking it to produce any more force. You're asking it to produce force over an even longer period of time. You're stressing it in terms of endurance, trying to get more out of it. And you can look at that in one of two ways. Running at the same speed, but for more miles. Or, I want to stick with running 10 miles, which is endurance no matter what, but I want to work on my time. I want to do it faster and faster and faster. Which doesn't mean you're going to recruit fast twitch fibers. You're still going to be using primarily slow twitch. It's still a prolonged exercise, relatively low intensity. Doesn't feel like that, but that's because of how long you're asking the muscles to work. It's still not the same as sprinting. You're still stressing the slow twitch fibers. So how can they get better at producing ATP over an extended period of time? Give them more oxygen to work with. More oxidative enzymes, more mitochondria, more myoglobin, more blood flow, and therefore more capillaries, a higher capillary density. Again, these fibers get better at what they're already good at. What are slow twitch fibers already good at? Making ATP aerobically because of their characteristics, and those things are just further enhanced. And with endurance training, not only do you get adaptations from the muscles themselves, but also the cardiovascular system. Heart function, heart performance improves. Your cardiovascular system does a better job of getting more oxygen to the muscles. And once the oxygen gets there, these muscle fibers can now use it faster. They've got more enzymes, more mitochondria, and so on. Fiber types can also adapt to training by becoming more like the fiber type best suited for the activity. Although fiber type percentages in our muscles are genetically predetermined, we can shift the proportion somewhat, slightly, through training. For example, endurance training can convert type 2B fibers to type 2A fibers. Intermediate fibers that are more oxidative and fatigue resistant than type 2B. The way to think of it is you can't go from fast twitch to slow, but you can push a fast twitch to be more, instead of fast glycolytic, more fast oxidative through endurance training. And you can push an in-betweener, a type 2B, from fast oxidative to more slow oxidative. But you can't jump from slow twitch to fast twitch to slow twitch. But you can shift a little bit. And through resistance training, you can get your slow twitches to be more like an intermediate. You can get your intermediates to be more like a fast twitch. And I don't have a number to give you, but if you're genetically, let's say, quadriceps muscle group, 75% fast twitch, 25% slow twitch, which is what was estimated on my quads when I had this done years ago. If I'm 75-25, maybe through endurance training, I can become 70-30. It's a little better. I've increased my slow twitch percentage overall about 5%. I can get a little bit better at endurance exercise. But as I found out through endurance training, I can never be good at it. I can never be a marathoner. I mean, with a lot of training, the furthest I could ever run was about 9 or 10 miles. And that was exhausting.
So if you don't have it, you just don't have it.
Correct. Do people play basketball because it makes them taller? Is that why basketball players get so good at playing basketball? They get taller when they practice? No, why are they playing for that basketball in the first place? Because they're tall. And coordinated helps. We tend to do what we're good at already, right? And then we can get even better. Right? So you're not going to find many people with my body type running marathons. Barking up the wrong tree. And a marathoner might be 80% slow twitch, 20% fast twitch. And through some resistance training, lots of squats and lunges, jumping, a lot of power movements, sprinting, maybe can tip the scale a little bit from 80-20 to, I don't know, 70-30. But they're still never going to be, great at squatting and sprinting and doing power movements. Right? So you can get better, but it is genetically predetermined. So you kind of are who you are, and you take what you got, and then you see what you're good at.
How did you find that out, what you had?
You can get your fiber type estimated or actually measured. Measured, they have to take a muscle biopsy, and they actually count muscle fibers.
Wow.
To do it indirectly, which is what I did, it's called a Thorstenson's test. And so they had all these, huge sample, a huge sample of the overall population, different ages, some that are better at, endurance, some better at power, blah, blah, blah. You get all these people, and you have them do their isokinetic knee extensions. So the machine doesn't allow you to change the speed at which you do the knee extension. It's just a matter of how many you can do before you fatigue. And based on all these algorithms, depending on how many you perform, it comes up with a certain blend percentage of fast twitch versus slow twitch. So there's an indirect way to do it. But I could tell for me it was very accurate. I'm naturally good at power, at fast, but horrible at endurance. I mean, you could take somebody who's, a slow twitcher, great at, long distance, practice sprinting for 3 months, and they go, okay, I'm ready to race you, and I'll probably blow them away, even though I haven't ran in years.
Oh, wow.
It'll hurt, and I'll get cramps and scream, but I'll beat them. Overload principle is what I was talking about with you have to keep stressing the muscle. If it's resistance training, you have to keep increasing the load. If it's endurance training, you have to keep increasing the distance. You got to keep stressing the fibers. And then atrophy is the opposite. So you can spend all this time stressing the muscles, improving your endurance, improving the size and strength, but then when you stop, you lose it. You gain it pretty quickly, you lose it pretty quickly.
So when you're lifting weights and you're dropping weights, does that make sense? So usually I'll do lift 20 for 12 reps and then go down to 15 and just do that in the next 12 reps. Is that increasing endurance? Or?
Yeah. Usually, if you're having somebody exercise, and it's usually females, for tone, for definition, visually to improve, the look and feel of muscles, high reps, low weight. You occasionally have females that just want to get really strong for whatever reason, but then you have to burst their bubble and remind them that they don't produce very much testosterone. So no matter how much weight they try to lift, they're just not going to get that big because the hormones just aren't there. On the flip side, and I used to get this all the time, I was a personal trainer for many, many years, I would get females coming to me asking for the first. I just want to tone up. I don't want to get big. I don't want big muscles. And I'd say, okay, well, I'm going to have you do this. No, I don't want to lift weights. I don't want to get big. You won't. You won't. I promise. Unless you start injecting, you're not going to get big. It's just part of being female. However, we all know that there's a spectrum out there, and there are males who are more feminine, for lack of a better word, as far as their body structure, very petite, skinny, eat a ton, try to lift weights, just can never put on size, right? The hard gainers. You've got women out there who have a naturally large build, strong muscles, and can be very strong and lift lots of weights. But we're just talking on average. On average, men tend to be able to put on size and strength much more easily than women. And it comes down to hormones. There's a way around that, right? Injections. And it works.
And then she starts talking like this.
Female body builders, they also inject testosterone?
I can't say all of them do. But if you look at them and they look like a man, there's a good chance. Yeah. But they're so obsessed with their sport, they don't care.
But that's not natural. That means that's like psychologically faking yourself.
But men do it too.
Well, that's just, I think self-esteem more than
All right, we're done with 9. I mean, it's on there, but I had to pick and choose to get through.
When is it gonna come out?
Well, it's all fair. So on the handout, the remaining questions that you should now be able to answer. What is the difference between physiological and psychological fatigue? That's right off the study guide. What factors are thought to contribute to physiological fatigue during short duration, high intensity? Just covered that. Number 5, which factors, blah, 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 fatigue, long duration, low intensity, just covered that. Differentiate between aerobic exercise and anaerobic exercise, covered that. Describe the changes or adaptations to skeletal muscle in response to aerobic exercise programs. And briefly describe the changes, adaptations to skeletal muscle in response to resistance training programs. So all of the stuff we just covered. I don't need to post an answer key because you have it. It's your study guide. It's all there. All right, chapter 10. Chapter 10 is 2 pages. One page back in front. And I think chapter 8 is similar. Most of the lecture exam is chapter 9. Right? The exam is always weighted based on how much time you spend on the information. So you're getting a half lecture on 10, a half lecture on 8, and you had what, like 3 full lectures on 9? Mm-hmm. So it's weighted accordingly. Mm-hmm. And for both, there's way more on lab exam than lecture. And that's why the study guide for 10 is so short. Outside of naming muscles, identifying origin, insertion, action, innervation, outside of that, there's not much else. It's very similar to chapter 7 for the skeleton. I had just a few functional questions. You know, functions of paranasal sinuses, functions of spinal curves, that kind of thing. When it comes to muscles, basically it's understanding the terminology. What is origin? What is insertion? For the functional groups, making sure you know what it is to be an agonist, an antagonist, a synergist. And then we spend a bit of time on naming skeletal muscles. And we kind of did that with bones as well. So, so at first you had a general understanding. What's a fossa, a foramen, a tubercle, a tuberosity. So same thing here. It's going to make it a lot easier for you to learn the muscle names if the names have meaning to you. And then the last thing is just muscle fiber arrangement. The different types of skeletal muscles, based on how the muscle fibers insert onto their tendons. So really just 3 topics. All right, so number 1, skeletal muscles and their actions. The origin is the point of attachment at the fixed bone. The insertion is the point of attachment to the bone that moves. That's in general. You don't always have a muscle that's attached to an immovable bone at one side and a movable at the other. Sometimes they're both immovable, sometimes they're both movable. And then which is origin, which is insertion becomes sort of arbitrary. But someone has made that decision, and if you look in an anatomy book or a kinesiology book, which is what I have up here, this is the best book for learning origin, insertion, action, names for all the muscles. Because what they do better than the anatomy books, they remove every other muscle that gets in your way of seeing the whole thing, and they draw just that one muscle, nothing else around it. So it's the best way to see individual muscles in their entirety. And they, right next to it, they also just shade in the attachment sites. So you can actually see where the insertion and origins are, what they look like. So you can see similar diagrams in an anatomy atlas, like the Gilroy Atlas, the Netter Atlas. If you want to pick up one of these, the author is Floyd. You can find used copies of like the previous edition for $5. And I skipped actions because I'm going to go over them with you in a minute. I actually have all of the actions listed in the Chapter 8 study guide. So we'll come back to actions. So muscle attachments, you got your origin, your insertion. Functional groups, agonist, antagonist, synergist. Agonist is the prime mover for a given action. In the chapter reading, and you should read chapter 10, just like chapter 7. I know it's mostly anatomy, but you need to get some understanding of what the muscles do based on how they're attached to the skeleton and what their names mean. And if there's multiple muscles that do the same thing, you need to know which one is primarily responsible, and therefore the prime mover or the agonist. For example, biceps brachii muscle. Because of its attachments, and here's an example of why knowing the attachments actually tells you the action. If it attaches at the shoulder joint anteriorly, it crosses the elbow anteriorly, attaches to the radial tuberosity. Right? So a muscle that goes down the arm crosses the elbow joint anteriorly. If this attachment and this attachment start getting closer together, what's my arm going to do? Think of a rope between these 2 points that shortens. It's going to pull my forearm up. If I have a muscle on the back that starts up here at the shoulder joint, goes down the arm, crosses the elbow, and inserts right here, and I'm already in a flexed position, what's going to happen when I contract the muscle back here? Right? So based on attachments alone, you can typically figure out the action. If it crosses the elbow joint anteriorly, it's going to cause elbow flexion. If it crosses the elbow joint posteriorly, it's going to cause elbow extension. Well, it turns out, in addition to the biceps brachii, you have the brachialis muscle just underneath. You have brachioradialis, which is over here. If you push up, it sticks out. A lot of these muscles you can find on your body. It crosses the elbow joint anteriorly. It actually starts down here. It goes up the forearm, crosses the elbow, and attaches right about here. 3 muscles that cross that joint anteriorly. Of those 3, which one's most powerful? That's the one we call the prime mover. Biceps brachii. It doesn't necessarily have to be bigger. It also matters how it attaches to the bone. If I had a muscle that was half the size of biceps brachii, but it attached to the forearm here instead of here, Here it's really close to the fulcrum. Here it's really far away. I have a longer force on it if the muscle attaches here. And then when it shortens, it does the same thing, but it's going to generate a whole lot more force. So it's not just size, it's also the biomechanics, how the muscle is attached to the skeleton. They get into the biomechanics in chapter 10. I've tried covering it in the past. It's not worth it. You guys are like, what? Plus I got to know all this other stuff, so I just stick with the other stuff and don't worry about the biomechanics. You only really need to know it if you're going into PT. And if you're going into PT, you're going to cover all this stuff over again in more detail anyway. So what do you think the antagonist does? If the agonist produces a particular movement like elbow flexion, what does the antagonist do? The exact opposite, which would be elbow extension. So if biceps brachii is the agonist, what's the antagonist? Triceps brachii on the other side. To be an antagonist, you have to do the opposite movement. Synergist. Brachioradialis. Brachialis. Those are synergists for biceps brachii, which is the prime mover or agonist. That means they help. A synergist helps. Helps the agonist perform the movement. Now there's a different type of synergist called a fixator. Instead of helping the agonist produce the same movement, the fixator stabilizes the joint so that the agonist can do its job efficiently. For example, you've got a bunch of muscles that cross the shoulder joint. Pectoralis major in the front, right, for flexion and horizontal adduction. You've got deltoid muscle. It's got fibers that cross the front, fibers that cross the side, fibers that cross the back. You have latissimus dorsi, crosses the back of the shoulder, causes extension. All of those different muscles allow you to move at the shoulder. While they're doing their job, fixators, which is the rotator cuff muscles back here on the scapula, will be contracting and keeping the head of the humerus pushed up against the scapula. So a fixator is a type of synergist, but it doesn't help the other muscle perform the movement. It stabilizes a joint. Naming skeletal muscles. And I broke this down into groups. You have locations, muscles named by their location. This is where those body regions that we covered in chapter 1 come in really handy. Examples: temporalis muscle, external intercostals, rectus abdominis, brachialis. So where do you find the temporalis muscle?
In the head.
Temporal bone. External intercostals.
The thoracic cavity.
Inter, between the ribs. And if you have something called external intercostals, then you must have something else called internal intercostals. And they're just a little deeper. Abdominis muscles. Abdomen. Brachialis. Arm. The brachium. Some muscles are named based on the relative position of the muscle. Extrinsic versus intrinsic. Extrinsic eye muscles are the ones that attach to the outside of the eye and actually rotate it so you can look up and down and medial and lateral. Those are the 6 muscles that are attached to the orbit model over there, in the top corner of the shelves. Intrinsic eye muscles. Those are muscles inside of the eye that change the diameter of the pupil. Superficial and external. You have flexor digitorum superficialis. Oh, those aren't antonyms, those are synonyms, sorry. Superficialis and externus both mean superficial. Profundus and internus both mean deep. So if you have one named flexor digitorum superficialis, then there's got to be another one that's not superficial, that's more deep. In this case, we call it profundus. Flexor digitorum profundus. What else does that name tell you? Flexor digitorum superficialis. Flexor is what it does. It creates flexion at a joint. Digitorum, flexion of the digits. Flexor digitorum. It tells you what it does. It flexes the digits. And it turns out all of the flexors are on the anterior forearm, and all of the extensors are on the posterior forearm. Or if you have your hand like this, handshake, and you go like this, you're contracting all of the flexors on this side, and you go like this, you're contracting all of the extensors on the outside. They're all grouped together. Next group is orientation of the muscle fibers or fascicles. Where's rectus?
At the end of
We don't really have a picture of rectus. Rectus means straight. So when you look at the fascicles, they all run in the same direction. So rectus abdominis looks something like that. If you look at the extrinsic eye muscles, there's a superior rectus, inferior rectus, medial rectus, lateral rectus. All of the muscles have this orientation where all the fibers, all the fascicles, run parallel to the longitudinal axis of the muscle. One's over the eye, one's under the eye, one's on the medial side of the eye, one's on the lateral side of the eye. But all those muscles look the same. They're all straight, rectus. Oblique. That means the fibers run at an angle to the longitudinal axis of the muscle belly. Transverse. Now the muscle fibers or fascicles run in a horizontal plane. And circular. The circular muscles form sphincters. Entrances and exits to our tracts. The entrance to the digestive tract, orbicularis oris. Orb, orbicularis, circular. What does oris mean? Oris, orad, oral, mouth. Circular muscle around the mouth, orbicularis oris. More so with muscles than anything you've seen thus far. Every single name gives you a lot of helpful information about the muscle. Don't just memorize the names for what they are. Break them down, understand the translation. What does it mean? Muscle attachments is another one. Usually the first part of the name indicates the origin and the second part of the name indicates the insertion. Classic example of this one, sternocleidomastoid. What does sterno refer to? Cleido. Clavicle, mastoid. Mastoid process of the temporal bone. So this muscle has 3 attachments. They are, the name tells you, sternum, clavicle, mastoid process. I might have a picture of this muscle. No, I just have a little bit of it from the back. This is part of it here. And then it comes down the front and it goes down to the clavicle and the sternum. And when one of those muscles contracts, it tilts your head to the side. When they both contract, it's flexion at the neck. Structural characteristics, and there's several of them. Characteristics including the origins, the number of origins, sorry. Not where they are, but the numbers. So that's seps, C-E-P-S, biceps brachii, triceps brachii, quadriceps muscle group. Quadriceps, 4 heads, 4 tendons. Biceps, 2 heads, 2 tendons. Triceps, 3 heads, 3 tendons. So when you're looking at origins and insertions for biceps and triceps, it's multiple. The biceps has 2 heads, 2 origins. Both go to the scapula, but different parts. One goes to the coracoid process, the other goes to the supraglenoid tubercle. And then the insertion is singular. It just goes to the radial tuberosity. 2 origins, 1 insertion. But the name tells you there's 2 origins, biceps. The shape. And there's lots of these. Here's a whole list right here. Deltoid is triangular, orbicularis circular, pectinate comb-like, piriformis pear-shaped, flat, pyramid. Serratus serrated. That's sort of like lacerum, lacerated. Serratus serrated. Teres is long and round. Trapezius, trapezoid shaped. And rhomboid shaped. Here's trapezius. Looks like a big kite. And then if we peeled the trapezius away, which is a superficial muscle, underneath you would see the deeper rhomboids. Rhomboidus major, rhomboidus minor. If this is the middle of the back, major looks like this, and minor looks like this. And the general pattern is, minors are always above majors. Teres major and minor, zygomaticus major and minor, rhomboidus major and minor. The minor is smaller, but it's always above major. Muscle size or appearance. Lots of these as well. Adduction. Adduction is bringing a body part towards the midline. So if I start with my arm out here and then I bring it in, this is adduction. When I move it away from the midline, that is abduction, A-B-D. So think of getting abducted, taken away from midline is abduction. Adding to the midline, adduction is returning, moving towards the midline. So you have these groups of muscles on either side of your hip that either bring your leg out, abduction, or back in, adduction. And there's lots of adductors. They're on the inside of the thigh. Big group, the adductor group. And there's adductor magnus, the biggest of them all. Adductor longus, the longest of them all. Adductor brevis, the shortest of them all. So this is naming muscles based on size or appearance. Zygomaticus major, zygomaticus minor. Minor is smaller, major is larger. But it also happens that minor is always above major in anatomical position.
When you say above, is that physically above or is that super deep, superficial and deep?
All of the major minors are on the axial skeleton, so superior, inferior. literally above, below, not superficial deep. And then lastly, action produced. Lots of muscle names tell you what they do. So the adductor group, the name tells you. The action is adduction. The only thing you would have to add is where. Is it adduction of the fingers? Is it adduction of the shoulders? Is it adduction of the hip? You have to be specific. So every time you describe an action, you are going to say of the or at the. Right? Flexion at the elbow versus flexion at the spine versus flexion at the knee. Can't just say flexion. Flexion and the joint where the movement is occurring. There is an alternative, and that is the action name and the body part or bone moving. So here's an example. You can call this elbow flexion, and I always go with the joint name. It's more logical to me, common sense. Or you can say forearm flexion, which doesn't make as much sense to me. But the forearm is the region that's being moved, right? When biceps brachii contracts, it pulls, it moves the forearm. So you can call this forearm flexion, or you can call it elbow flexion. I think it's safer to stick with the joint where the movement is occurring, because that's easily identifiable every time. And I always, when people go with the body parts, they always mix up forearm and arm, and leg and thigh. How about this movement? Tell me what kind of flexion this is. Start here and end here. So that's named after the joint, shoulder flexion. All right, so now do it on the body part move.
Arm action?
I don't see much confidence out there. See what I mean? Shoulder's pretty straightforward, right? Is this forearm flexion?
No arm.
Well, my forearm's moving.
But your arm's moving too.
You see what I mean? This is arm flexion. This is forearm flexion. How about when I move at the hip and I bring my leg up? That's flexion at the hip. Or, not leg. Leg's moving, but it's not leg, it's thigh.
So what would a leg flexion do?
Stick with joint.
Yeah.
That's my advice. Last topic, muscle fiber arrangement. The muscle fiber arrangement determines, to some extent, what the muscle can do, the action, and also the range of motion and the amount of force it can produce. The four patterns of fascicle and thus fiber organization are parallel, convergent, pennate, circular.